Hi everyone, I'm Allan Barizo, a P2, and I'm here at TSHP. It's my first conference ever in pharmacy school, and me and Raymond just got finished, or Raymond and I just got finished with the clinical skills competition, and I'm pretty stoked, right after it because it's finished. Like, I was really stressed out about it a little because of the case preparation. Basically, it's kind of like in the same format as ASHP's clinical skills competition. We had a really hard case though. Actually, it was the same case that even the residents got, and they were having a hard time with it too. So you can imagine how it was like for the P1s and the P2s. We didn't really know a lot of those disease states. Like our patient, he had everything under the sun, like hyperlipidemia, hypertension, sepsis, stroke, what else? Seizures, just so many different things, and you couldn't look through DePiros for the life of you to refresh yourself on each of these disease states. But basically, we finally plowed right through it, and we think we got our problem right. I don't know if it was, but it was sepsis, and during the presentation, we were kind of worried, but they were pretty nice. It actually went better than I thought. They just, we didn't really present the patient, but we just presented the problems that we had. We only had time to go through one problem, and they just interrupted us a couple of times to clarify things like, what did you think about the lab value here, or why did you do this therapy? Why did you increase the vancomycin? And we just had to answer them. Some of them we could answer, like for the vancomycin, we said it was because the levels were low. I don't know if that's right, but that's what we said. Others, like, forgot what the dilantin, they asked us if the therapy was adequate or excessive or just right. We didn't know, so there's sometimes you have to tell them we weren't sure about, but I guess they understand since we're P2s. But overall, it was a really good experience. I'm glad I did it. I recommend it to everyone else to do it. In the future, if they ask us for any feedback, I would definitely tell them that they need to make the case a little easier for the P1s and the P2s. But because you're kind of like a fish out of water when you're presented with cases like that. But I hear that's what it's like in P4 years. Sometimes you don't know what's going on your first day on rotation, so just get used to it. Other than that, I also did the DSM, which is the Disease State Management Competition. In our case, I was actually lucky, the P2s, because we had the disease state was asthma, and we already had that in therapeutics the month before, so I was pretty familiar on how to use it, and I've used an inhaler before, so that was good. What's it called? Basically, how that worked is the first 10 minutes they give you time to look over the patient profile and to see what things you want to talk to the patient about, questions to ask the patient, what you want to change. It's kind of like a glorified patient counseling competition. What else was I going to say? You think of it as kind of like a follow-up at the doctor's office, what the doctor would do or should do with the patient, going over the medications that they're changing with the patient, or making adjustments to the therapy. So after the first 10 minutes, after you're writing your notes, the second 10 minutes you're with a mock patient and judges, and you have to educate them on the usage of the medication, educate them on their disease state, tell them about things like, well, in our case it was asthma, so I taught them how to use an inhaler, an albuterol inhaler. Also, I taught them how to use a Advair inhaler. Didn't have time to do the peak expiratory flow meter, but I put it in the soap notes, that qualification or something. After that 10 minutes, you would go back and write a soap note. So especially for the P1s, I suggest you look over how to write a soap note, because the P2s already have experience with that, kind of with our labs. The P1s usually just have one lecture and I don't think y'all write anything. So P1s, definitely, if you're gonna participate in this, which I highly recommend, try to write soap notes. Get used to it. The DSM was an easier competition. I think I did well. I'd give myself a 7 out of 10, 8 out of 10, so pretty happy with that. Other than that, conference experience, you know, at first it was exhausting yesterday, but today, Saturday, like with the exhibitions and just meeting new people, actually finishing these competitions, I feel so much better. Next year I want to do a poster. After seeing all these UH students doing a poster, it's just inspiring to see how that's done. But I totally recommend people to come to these conference experiences, do a poster, do the DSM skills competition, clinical skills competition, and get involved. It looks good on your CV, if anything. Anything else?